Okay, I think so. Well, hi, everyone. Thank you. Welcome to the webinar for our advisors, our pre-med advisors, to learn more about this program. My name is Sue Barros. I'm the Director of Enrollment at University of Queensland Ochsner Clinical School. And I have a presentation that I can go through. And let me share my screen. All right, and is everyone able to see that?
Yes.
Great, I hope so. All right, great. All right, well, let me get started. Been in presentation mode. All right, sorry, that's not my first slide. Okay, so this is actually the St. Lucia campus in Brisbane, Australia, on the campus at University of Queensland. And it's really beautiful, very spacious and very modern too. Actually, it has some really old buildings, but it's very modern. And our students, this is them probably on one of their days at campus. So I want to show you this slide. I really love it because it shows where we are in the world. There's New Orleans, and then that's where I am, located on Ochsner's campus in New Orleans, and then in Brisbane. So, I mean, heard of Brisbane, but there it is. It's on the east coast of Australia. I didn't know exactly where it was, but I just really love this slide. It's beautiful and shows where we are located. So the University of Queensland has been in existence for a long time, and they are really not just a top 50 university. When US News and World Reports came out, I went to their site and I looked for the top global universities. And I found that there are actually 37. So really, they're a powerhouse in their own right. Ochsner Health is located in New Orleans. It started in 1942. So we've been here for over 80 years as a teaching hospital. And Ochsner is very innovative, and they're a community leader throughout the Gulf South. If you live in the Gulf South, you probably heard of the name Ochsner. So it's very well known here in these parts. And Ochsner's really done an excellent job of training medical students for decades. All these decades, they have been training medical students, and they noticed that their students always perform well in the math. And that's kind of started the idea of creating their med school. But they wanted it to be a little bit different. They wanted to see an ease of applying. As we know, it's so challenging to apply for med school. And so they wanted to really make it be easy to apply. And then they wanted to look just at the person, not necessarily the competition, and a little bit, but look at each individual and hear from them individually. And they also wanted it to have a global component. So that's where we searched for the appropriate match for a partnership for a university, a medical school, and we partnered with the University of Queensland. There's a lot that's in common between our schools, like the school and Ochsner Health is both really been around for many decades. And that fact that they're top 30 within the top 30, well, 36 in US News and World Reports is great. And research is something that they've also connected on very well. We have many research institutes there, and our students get to participate in the research and then also bring that here to Ochsner, where we have a lot of research as a teaching hospital. So let's talk a little bit about the program. So it is a 4-year MD program, and it's full-time. Our students spend the first 2 years in Brisbane, and then in the year 3 and 4, they come to New Orleans and rotate through the Ochsner facilities. Part of the certification and the program is to become ECFMG certified, and they do that by completing a residency in the US, just like all US students have to complete the residency to be able to practice in the US. And we have students that practice in all 50 states, and some that stay in Australia as well. So it is, so this is how the years look at each time. Year 1, what's a little bit different about studying medicine in Australia is that in the first year, they have 1 day of basic clinical skills. So they do have 4 days of structured learning, just like we do with lecture, lab, and different types of delivery methods of teaching. But the 1 day in basic clinical skills could be teaching a skill like scrubbing in or suturing or something that you will use when in a clinic or hospital setting. But by year 2, and you're going to be only in structured learning for 3 days out of the week, and the other 2 days you are going to be in clinics learning to take hospital history and physicals, those types of things. And then when you come year 3 and 4, that's when your clinical immersion really begins, and you are teaching for you're within the teaching hospital for all of your year 3, and you do the different rotations through different clerkships. And year 4 is when you're really preparing to go into your residency for advanced practice. So these are the different types of learning experiences. It could be a lecture, then labs, but there are master classes where you learn there's a skill by an expert that can really do something proficiently, so they share that information with the class. There's hands-on workshops and small team-based learning. So all of these different kinds of delivery methods of teaching are incorporated into the curriculum. I mentioned research was something that's important to both entities, and students can obtain a higher degree by research. So that means they can add a Master's of Philosophy to their MD program or a PhD to the program. If students wanted to not add a degree but have experience with research, they can go to our tab on our homepage, the Research tab, and scroll down to find the Student Research Hub. So I did that. I went to see what types of research are available for students to participate in, even without adding a degree. And these are some of the examples that I found on that page. So they can just get experience, whether it be that they're thinking about research, or if they wanted to add something to their resume, maybe data entry or how to collect data or be an author. All of these things are possible through the Research Hub. Okay, then medical student support. Since our students are not just across the world, but they're in the Southern Hemisphere, everything is very different when you're there. And we realize you're very far away from your family, your support system, all your friends. The time differences are so different. We're asleep when they're awake, vice versa. So we realize we do have to have a lot of support for our students. And there's different types of support. There's the well-being support, which is just like your student health center. You can go there for any kind of thing at all, even like time management or adjustment to Australia. And then there's a personal advisor work network. And these staff members are really pay a lot of close attention to our students. You know, they connect with them quite often, and it also brings them in and makes them really feel comfortable when they're far away from home and adjusting to Australia. Our medical societies are led by teaching physicians, faculty that have a special interest in mentoring students. So there are full physicians that work here, but they take on this added role as a mentor. So each class is divided up into 5 societies, like the Ochsner Society, the Lejeune Society. They are named for the founders of our school. And these mentors track the students throughout all 4 years. And then they also probably write their letter of recommendation for residency program. We know USMLE support is really important. All students have to take this to move on in the US in their medical studies. And I have a slide on that. But we also have peer support with the University of Queensland Medical Society and also OMSA Medical Student Association. Okay, so let's move on. Here's about the USMLE. So all students to date, we have this slide to show the first time pass rate for USMLE on step 1 and on step 2. And then it shows the percentages there. And then we've moved to pass fail. So in 2025, you can see that was the COVID year. So it affected a lot of things for many schools. And it did give us a drop in that because those students were actually studying on Zoom their first year of med school. So it did have an impact, but now we're moving to pass fail too, as you can see that as well. So these are some of the preparation materials that are given. There's the first aid book, there's the Q bank, the question bank, practice exams that can be given and taken, study guide, and then there's a dedicated course, which I think is most important to prepare for this. Yeah, there's a whole course that preps them in the end of the second semester, and right after that's finished is when they take the USMLE. Okay, so let's talk a little bit about being an international medical graduate. So our students get their diploma and their degree from University of Queensland. So that means they're an IMG, International Medical Graduate. And so part of this program is you do become ECFMG certified to practice in the US. And the exam requirement is that you pass the USMLE, the board exams, right? Step 1, step 2, and then you get into your residency. So let's talk about match then, because we have this slide because if you look all the way to the right, non-US, the international medical graduates, these stats come from the NRMP, the National Residency Match Program, comes from their website. And you can see that last column, if you want to go through 4 years of medical school and face residency match, that's pretty scary, but to have those stats and numbers, it makes it even more scary. So most students don't want to face the match if they're holding a degree, and that makes them an international medical graduate. So as you can see, we have this throughout the years from 2016 to 2024. And the total number of applications really outpaced the number of positions that are available, as you can see by the positions column and the applications type column. So bolded is the UQ-Ochsner match rate. And as you can see, it's consistently in the 90 percentile. And we had an all-time high of a 99% match this year. So it's certainly, if you think about the bell curve with 59 at the top for IMGs, we're the outlier, right, all the way to the end. And it's consistent. And I think this is a tribute to my employer, Ochsner, because they have been around as long as the residency match program has been around. And the residency programs do know Ochsner very well. They know the caliber that our students are trained to, and they do become sought after. And you can see how it compares to the MD seniors, which are right there in where you can be seen of how we compare. And it's kind of neck and neck with the US. So students in our program match as well as, or even sometimes better than the US students do. And here are some of our matches that happened this March. They are in competitive fields, and they do match into competitive residency programs. And then, so that's this year in particular, but this next slide, a little glimpse at showing how over time, some of the places that our students have matched in and what fields. It's a little snapshot. And then we even track our students after they graduate and move on into their workplace. So this is postgraduate year 1, the evaluations. And if you can see the first quartile in orange, 37% from 2012 to 2021 score in that rate. And then the second quartile is, so if they're really doing well in the top 89% is really the top half of the top first and second quartile, right? So they do perform well even after they finish and go into their residency. Now let's talk about the academic entry requirements. So what we do need as minimal requirements, we have a 504 hard cutoff for the MCAT. So if a student wants to progress, if an applicant wants to progress their application, they have to get a 504 or higher on the MCAT. GPA, we need an A or B average, so 3.0 to 4.0. And then it's only 2 subject prerequisites. There's a cell bio and a systems physiology. So that's the only 2 prerequisites that we're looking for. And if an applicant does not fulfill the proficiencies that UQ is looking for, UQ will send an online option to complete. Then we interview. So 25% of the decision is based on GPA, 25% is based on the MCAT, but 50% is based on the individual during the multiple mini interview. And we are testing their personality and assessing that on certain traits such as kindness and compassion, verbal communication skills. And for our school, we have 8 10-minute interviews, successive, all in a row, and they are conducted by Zoom. So here is the ease of applying that I talked about. This is a free in-house application, so we don't want cost to be a barrier from Ochsner finding, these perfect physicians that's out there and applicants. So we really want to attract those kind, compassionate future physicians to our program, and we're trying to remove as many roadblocks as we can. So since there's only one in-house application, there's no secondary application, so no secondary fee. We also do not collect letters of recommendation. We do not have students write a personal statement or submit a resume with how much clinical experience they have. The reason for that is because Ochsner wants to find out from the student who they are. And that's why we have the multiple mini interview, and that's why a lot of the weight is placed on that. And we don't have 10 prerequisites, only the 2 that I mentioned. And you can even start your application without having your MCAT score. You can just enter the date that you plan to take it. Okay, so the scary slide, the fees. So this is kind of a typical competitive fee for a private med school institution. And it's about $67,000 each year for tuition. Good thing is that you can fill out the FAFSA and receive complete funding for all living expenses and tuition for the 4 years. Here's a good slide, though. We do have this great Ochsner's Physician Scholars Program. Ochsner knows the caliber they train to, and they want their students to stay with them. Also would like to improve the health of Louisiana and where our hospital and school is located. So they agree to pay 3rd and 4th year tuition. That's what the word 35 is, the cost of 3rd and 4th year tuition. If the student agrees to work for Ochsner for 5 years after they complete their residency. So, and right now it's in these fields: family medicine, internal medicine, pediatrics, and psych. And actually these are the fields that really attack these problems like that we have in New Orleans at its core. For example, diabetes and hypertension. Everyone really does eat fried food all the time in New Orleans, and it affects our population. So psychiatry for behavioral health, like maybe smoking cessation, eating disorders. You can still enjoy New Orleans food, but you can do that in moderation and have a healthy life too. So Ochsner's trying to promote that, and that's what this is about. And it's open to any of our students that come here and want to go into these fields. They can apply for this and receive 3rd and 4th year tuition paid up front. So a little bit of information about our demographics. This year, it's a little bit more female than male. I think that's the first year. It's more female than male. Our average age is 26. MCAT is 510. And we use a key degree to calculate GPA. So key degree means your most recently obtained degree. It's not a comprehensive GPA. It's only on that one degree, whether you hold a master's or a bachelor, that they will look at and obtain your GPA from that. And I think that's my presentation. So I'm going to stop sharing, and then we can also answer any questions that you might have. Okay, So, yeah, you can unmute and just ask if there are any questions at all that you have about this. It'll be, fine to just ask. So it is a little bit different, but Ochsner does really do well in the match consistently. Our students seem to love going to Australia for 2 years. I find students that maybe participate and study abroad, they can, they really love this and program because it gives them kind of a taste of that again. So I think it's a real, oh great, so your answer's not taken. Okay, so I think it's an excellent program and I'm happy to get to talk about it, but would definitely also like to answer any questions that you might have.
Hello, this is Nash. I'm not sure if you can hear me.
I can.
I think I was muted before. I apologize. I just wanted to ask a little bit more about the USMLE training. So it looked like on one of the slides it was integrated into the curriculum in year 2. Is that correct?
Yes, it is. It's so when you're in Australia, we have a cohort of only 90 students that we contribute to the incoming class at University of Queensland, which is larger, right? So those students in Australia, the domestic Australians, do not have to take the USMLE. There's more of there's not really a match, there's more of a placement that happens. But our students are matching in US residencies and they need it. So it's not part of the curriculum for the domestic Australians, but it's built into the curriculum of the Ochsner cohort. So it's a full semester class that focuses on helping them be successful at a first-time match rate, at a first-time test rate. First-time.
Okay. Yeah,
yeah.
so for the step 1 exam.
Yes.
Would there also be support for step 2 and step 3, or is that?
For step 2, that's right before they go into residency. So there is support for that when you're here. That's what the teaching part and the clinician part of it is about, and our mentors that we have. So there is support for that. When you're in for step 3, you're in your residency. So they've moved away from us, and I'm not sure how that works, but sure there's a lot of prep for it. But I think you're more so on your own for step 3 because then you're already been a physician for a while and working in your residency, and I might be individual institution specific too in what they do for each person entering into the step 3.
Okay, thank you.
You're welcome.
One other question that I had, just because I feel like we just kind of brought it up a little bit, is there a difference between the UQ medical school and the UQ-Ochsner cohort? Because some spend time for Australian medicine versus US medicine, or is it
that's the only difference. They follow the same curriculum. When our students arrive in Australia, the Queensland breaks them up into teams for their team-based learning. So you're in a team, and it could be with all domestic Australians. You might have an Ochsner student in your team, or you might have just foreign students that come from international students that come directly from other countries to Australia. So, but it's not that they're very cohesive and they study together and train together, but you're mixed in with the whole domestic population.
Okay, awesome. Yeah, glad to hear that it's like connected. I wasn't sure. I didn't actually realize that there was 2 separate fields, but now it sounds like that there's not. So that's awesome.
Yeah, it's really just that since the Australians do not have to take that, and we definitely want our students to be prepared. They're giving all the information, and they're recommended and to keep on track with study, because studying for that starts at day 1 of med school. It's nothing that you pick up that book 6 weeks ahead and go, oh my goodness, I have a big test coming, right? You're preparing all along, and there's a lot of guidelines in what Ochsner knows who's successful and what they've done to be successful, and they've built around that to make it just more of a smooth transition through every step of the way of what they need to accomplish to be successful on a first-time pass rate.
Okay, thank you.
You're welcome. All right. Well, I'm happy to answer any other questions, or if there's any information you need, I'll put my address in the chat box, which I think. And also my phone number. If there's any questions or emails that you have, happy to help. Share my QA box.
Could you post that one more time? Sorry, I didn't see it come up in the chat, so I was just trying to
Oh.
grab a copy of it.
Oh, gotta change to everyone.
Awesome, thank you.
All right, I really appreciate that you joined me tonight.
No problem. Thank you for hosting this. I guess one final question. I can't tell if there's anyone else in here that also wants to ask questions or not. But one other question that I had was just about the Student Research Hub. If there was more information about that online, that would be fantastic.
Okay, yeah, there is. If you go to, you just type in UQ-Ochsner, our page will come up, and you'll see the tabs that's across, and there's a research tab, and you
Okay.
scroll down for the Research Hub.
All right, awesome. Sounds amazing.
Yeah. All right. Yeah, and we're surprised so many students really do participate in the research. I attended a webinar presented from the research head at UQ, and the Ochsner students are prominent in participating in research. And we even have Research Week here in New Orleans at Ochsner, and our students do so really well with it and embrace the research, and we're really impressed with the work that they do with that. And like the level, I mean, you're already in med school. Like, I'm impressed. They're already in med school, and they have so much going on, but they really do participate in the research and take part in Research Week and speaking and posters and just all of that. So it's pretty impressive.
That's awesome. That sounds really cool. It would be really cool to see too how that research transitions with Australia and New Orleans. Kind of an interesting connection as well.
Yeah, definitely. So I did have a question, just now from someone. It says that, let me read this. It might be mistaken, but you accept students multiple times a year. Can you speak about that process? Yeah, I'm not sure if you guys can all, I'm getting some messages that chat's disabled. I think that it should be enabled. So I hope that you guys can enter the chat. But you're welcome to mute and listen in. But okay, so no, we only accept one time per year. Our academic year starts in January and it finishes in the beginning of November. So there are some breaks during the year. However, it's probably not enough time to fly home since class exams end in the beginning of November. That's the end of the academic year. And that is actually Australia's summer, right? Just like our summer, we kind of close down a little bit and universities are much slower. That's how it is for them. There's more of a great white life work balance for Australia. So they do shut down a little bit more than we do here in the US. And they have a really great break for them. It's the holidays for them, but it's the summer also for them. And then they come back in mid-January, and our students start second year, they come back in February. So they get a really nice long break to come home and spend time at home with their family and friends that they haven't seen for so many months. And during the year when they have a break, since it's not enough time to come home, I find that they're very cohesive. They travel together. I was on a webinar last night where our current students said that on their last break, several of them all went to Indonesia together. So since they're in the South Pacific and down there, it's really easy for them to get to these different destinations, and they make the most of it. Oh, so the onboarding experience. Well, our students arrive in Australia probably we recommend about mid-January, because like this year, first day of class is going to be coming up in January, February 4th. So if they arrive in mid-January, it gives them time to find their place to live. We have Facebook pages that we use for each class. They're maintained by the first and second year students. So when the new class is coming on, those students join the Facebook page and they network with our current students who, for like housing, if they're looking online and they find something that might come up unavailable, the current student will even go check that place out for them and tell them if it looks, how's it look? Does it look like the photos they're seeing online? Or even if a student is vacating to come to New Orleans, then they roll that apartment over to an incoming student. And the landlords really love that they have this consistent way of replenishing, someone to be at their apartment that they're renting. And it's really helpful in so many ways. They guide them through all of the onboarding. There's different things you have to check off, like there's the immunizations, right? And there's a background check that we do. There's a blue card that they have to fill out or obtain that to practice medicine and be working in Australia. So there's many steps that they go through, and we give them the list and guide them. But for them to speak with a current student who had to do that themselves, the visa processing is managed by the government, not by the university at all. So for them to be able to speak with a current student about how they navigated obtaining their visa, if they want to bring their significant others or family. So however that works, they help them throughout all of that. So onboarding seems to be a fun, exciting time. I did get to go to meet the incoming class this past January, and it's amazing experience. They might have seen each other in webinars like this, but then they get to see each other in person, and I get to welcome them as they come along with the school officials and the leaders of the school. So it's a really exciting time, and it seems like onboarding is pretty seamless. They have that down pretty well about all the steps, and it's very clear, but there's also current student support, which I think really makes the most impact because they've been through it. They had to look for an apartment. They know the neighborhoods, what's the ones that's trendy that students like to stay in, or what's the ones more geared towards families that have parks and schools, and which ones are closest to where they'll be working along the bus lines. They have dedicated bus lines that have their own streets with no signal lights. They just go, and it's just really amazing kind of public transportation that's there. So it's a pretty safe community and area and city, and our students really like it. The work-life balance is emphasized in Australia, where everyone takes time to enjoy their weekends and, shut down the computer. So they adopt that when they're there and seem to really become more worldly, more resilient. They get to see medicine, how it's practiced elsewhere in the world, which is quite different than the United States. So they come back as really more mature, more worldly, more resilient, self-sufficient, and they have friends that are locked in for life because they've gone through that. They're all going through it together at the same time, and they become very cohesive and forms very strong bonds and relationships. Okay. All right, I'm checking our chat room. If you have any other questions, I'm happy to answer them, or you can unmute if you'd like as well. All right, guys. Well, if we don't have any other questions, we can end it. But you have my email address, and that's a group email address. We all use it, but you just say, Sue, can you tell me whatever it is? And they know to direct it to me. And then that's my phone right here to my desk, and you can call that anytime. And sometimes I have a transfer to my cell phone, which is right here, if I'm going to be walking away from my desk for a bit. So always happy to chat and help you guys with anything. We'd love if you send us our students. I find that when I'm traveling, it's not, the name Ochsner is familiar in the Gulf South, but maybe not so much the rest of the US. So, and we haven't been around that long. Our first class started in 2009. So we have about 10 graduating classes and yeah, already. So the more we can spread information about this great program, great match rate, amazing training that students can receive, and what an experience, and then also the ease of applying. I always think of students who maybe are waitlisted, and they could be excellent students with excellent competitive GPA and MCAT and still waitlisted. And I mean, this is a great option. They could just fill out a free application and see where it goes if they think they want to spend 2 years in Australia. But I wouldn't worry about the match rate at all, because as you can see, every year it's always been in the 90th percentile and oftentimes outpacing the US match. So if you have an adventurous student that thinks they might want to live 2 years in Australia, please recommend our program. I think that they would enjoy it. All right, guys. Well, I think that we can end our program here, but I want to thank you for spending this time with me and learning more about this program. So I'll have a great night, and I'm here for you to answer anything or help you in any way. Okay.